upright position, don't want them slumped forward. That, if they're slumped forward, they might get low back pain when you're doing this. And then you get kind of a false positive. As we're going to talk about in the lecture, anytime you get a positive with an orthopedic test, you always have to ask where the patient is feeling pain. So let's say I pushed down on Michelle's neck and she said, ow. I have to figure out where that's going, where that is. Because it could be in the low back. If that's the case, it's not a positive for cervical compression. I did something wrong with the patient positioning, or their low back's just really irritated right now. So location is important for pain. Location is also important for any type of symptom. If they say, oh, I have numbness, ask where, and then try to map that out. Figure out, you just get more information. So again, we're going to talk a lot more about that in the lecture. Michelle's in a nice upright position. I tell her, what I'm going to do is press down your head. I want you, after we're done, to tell me if you have any symptoms anywhere. I try not to narrow it down. I wouldn't necessarily say, tell me if you have sharp shooting pain down your arm. I want to know about anything, and then it's my job to weed out the weird stuff that doesn't make any sense. So, when we're compressing, we have to, really when we're doing any kind of force to the patient, we usually ramp up the force slowly, and then come back out of that force slowly. As far as how much force, I'm just going to let Michelle tell you about how much in her, you just describe how much. You don't have to say a number or anything. I want to try to stay away from a number. It's significant, and probably more significant than a lot of you would consider. So I want you to just describe that. So, hands are like this. My elbows are in the air. If my elbows are resting on her shoulders, I wish that would make any sense. But for some, there was one term where the students thought the instructor said to do that. That wouldn't be cool at all. Digging into her traps, and everybody's tender here. It might feel good. For a lot of people, it's going to be tender. So make sure the elbows are in the air so they can move. Hands are like this. And make sure I'm pressing straight down the spine here. And I press slowly. Wrap it up. And then back off a little.
Slight and then moderate.
Yeah, so I was leaning in. Mostly I was using my abdominals to squeeze and my arms to squeeze. You didn't see a lot of motion because there's really not a lot of motion available there. But if I had to put a number, it's like 40 or 50 pounds of pressure. So a significant amount, and I will use more pressure on the cervical compression than I will do with maximal foraminal compression. Because I really want them to test positive here. Because if they do, I'm not going to be sadistic and then do maximal foraminal compression, because they will be positive. So I'd rather be vigorous here with the spine in neutral than with the next test, which we use extension, lateral flexion, and rotation. So if I want to test the right side, I'm going to put Michelle's head back here. It has to be all one motion. You don't want to necessarily do this. Even though it kind of gets you there, with some people, their neck will bind up a little bit in one of those motions, and they won't get back to this quadrant. Basically, you want them to go from neutral back to that quadrant back there like that. So they're essentially trying to look over their shoulder and get their head behind their shoulder. So I just position the patient. This is the way I did it in the last class, but everybody asked their patient to put their head there. Don't do that. Just do this. It's much easier for me. I know exactly what I need to do, then I don't need to fumble on my words or anything, have the patient misunderstand. Put the patient here. Spine's still here. That's where I'm going to be pushing straight down. I'm not going to be cranking out here, because that's going to hurt everybody. And not like harm anybody, but it's not going to feel comfortable for anybody. So, neck goes here this time. Okay. Put your neck like that. Lean in like this. Make sure I'm pushing straight down the spine. Nice and slow layout. How'd that feel?
Good.
And that's an error.
So you said you had about the same amount of pressure as you did with the
I
other?
probably did there because we didn't get any positives. Yeah, it's about the same. That's not incredibly necessary. But did you feel any symptoms at all? All right. Let's say she did. What would be my next question? Where? And it's very common to have very localized neck pain. You still want to write it down, but it's not a positive. Or if you say it's positive, you would say positive for localized pain around C4 on the left or the right. So you'd be as specific as possible. A classic positive, we're going to talk about this in lecture, down the arm. arm symptoms, reproduction of some of the arm symptoms. But you can have lots of different types of positives.
And you said if the symptoms are on the right, you're going towards the right, right? Correct. To make
You always do them both.
smaller.
You always do them bilaterally. But when I did this, I was testing her right foramen.
Okay.
And then I would test the other side. Even if her symptoms are down the right, still want to do bilateral. Because who knows? They could have bilateral symptoms, which would indicate there's something else going on potentially. Or it can indicate that's really bad.
You're testing the foramen for...
You're compressing them.
So what number, I mean, could it be a number of things, like if they had...
Yep. And we'll go over those in lecture. And they're also in the notes.